811. Let's try it. Supposedly, I can escalate it.
Welcome to Health BC. If this is an emergency or you or someone in your care has chest pain, difficulty breathing, or severe bleeding, please hang up and call 911 now. Please note, personal information is collected in accordance with the Freedom of Information and Protection of Privacy Act. This call is being recorded for quality assurance and training purposes. Please have your BC Services card or care card ready, and a health services navigator will be with you shortly. Please listen carefully to this announcement and both menu options to select a service that can best assist you. If you have a health-related question or concern, such as finding a health service in your community, requesting health advice, or a nurse, dietitian, pharmacist, or exercise professional, press 1. If you are calling about the Health Connect registry and to register for a family doctor or nurse practitioner, press 2. You can also find information and register online. Visit healthlinkbc.com.
Oh, I accidentally pressed the number sign.
Hello, my name is Marcia. How can I help you?
Oh, hi. I accidentally pressed the number sign, so I don't know if I got a specific department or...
What are you looking for?
I got an email from Provincial Virtual Health that says I can call 811 and get an RN to escalate to a virtual physician because I'm running out of my medicine today and I haven't been able to get any services from virtual in a timely manner. And the last one was supposed to be this morning, but they canceled because supposedly they believe they don't prescribe for ADHD, although that's not why I take my medicine.
Okay. We can bring a virtual doctor on if the nurse feels the need to, but not to write a prescription. They don't write prescriptions here.
Okay, so that means you can escalate to a virtual physician to send the prescription to the local pharmacy?
No, they don't do referrals. They don't do anything to do with medications. Who you have an email from somebody?
Yeah, so this person says, and this is an email from Provincial Virtual Health, PHSA. It says, hi there. My name is Martin, but the person didn't use it. You can call 811 to talk with an RN who is able to escalate to a virtual physician. Have a great day. Because I was asked, yeah, go ahead.
Yep, that's all they can do, get a virtual physician, but our physicians don't write prescriptions or do referrals. So if you're looking for one of those, we don't do that here. We just have access to get a doctor on the line if the nurse deems that you need a little bit of extra advice. But we do not do prescriptions or referrals here.
Okay, so that's strange because my question was specific to that because I wrote to the person, Dear Madam Sir, can you please provide me with a non-region specific 800 number so I can call in order to receive the semblance of virtual medical care? I do not live in any specific region of BC, and I certainly do not have a reliable GP of my own. I live in a used and incomplete camper van, and I need to renew my medicine immediately.
Huh. Then they don't know our services, unfortunately. But yeah, no, we don't do referrals or prescriptions at this time.
So what do I do because, I have enough just for the morning of my medicine?
Oh, yeah, you probably have to go into a hospital then. You're not going to get anything that quick. You can make an appointment with a virtual doctor. I can give you a website, but they're, if not busier than trying to get a walk-in appointment. So nothing's going to be that quick unless you go to emergency today to get more medication to get that emergency prescription. Unless a pharmacy will give you an emergency supply. Have you ever done that in the past?
Yeah, I've done it once. So does any pharmacy? Yeah.
They won't do it more than once. You only get one. Everybody gets one chance. Yeah, so that won't help you at either. So your only option today to get more medication if you need it that quickly is the emergency department. Other than that, moving forward, you want to try and book at least when you've got at least a 30-day supply of medication left. Start booking for your next refill or next prescription requirement.
Yeah.
It can't take that long.
Yeah, I know that I've procrastinated, but the reason I procrastinated is services are dehumanizing, and it's almost like I'd prefer to stop taking my medicine. So the system needs to look at itself in that way. And I've given complaints, and when I follow up with complaints, eventually they say, we're finished with your complaint. And I say, well, what did you do? And the person taking complaints in Northern Health says, nothing. We just file your complaint. We can't do anything with it. So that makes me wonder who is sicker between me and the people that work for, the medical system.
Oh, absolutely. I totally see where you're coming from. Anyone that can complain, I don't know if this has been ongoing for years, so there's been no change, and we still have a shortage of doctors, so there's still going to be a shortage of prescriptions being written and the access to them.
And I've been on this medicine for about 10 years or more. So, I mean, I keep hearing over the years that I won't need to, make a doctor rich, a new one every time by renewing, that there could be a pharmacy system or another kind of system. It's not coming into.
Yeah, there's talk of that, definitely. When it happens, we're not sure. But at some point, you have to see a doctor to get a renewal. But yeah, they will be able to do renewals for, we don't know the length of time, whether it's a 3-month supply or I don't know that. But that is in the works, not as of yet.
So what I'm going to do is, because I'm house sitting and there's animal friends here, but I'm going to try and go to the emergency room later this evening and see in this town if it's open and I can do that. But one time that I went to an emergency room in Castlegar, the doctor wanted all the cash in my wallet to write the little piece of paper for the prescription. So for me, there should be a.
That was a private doctor then?
It was in an emergency room of a hospital. Whether it's private doctor or not, you can't mix public and private sector like we are doing in Canada. That's part of the problems.
Charging you. I've never heard of that.
Well, it's a young doctor who's doing like every other doctor is doing because he knows he'll get away with it. So it's not okay, right? So, I mean, if I complain to the RCMP, they're going to think it's funny because it's the norm.
Well, you can reach out to the College of Physicians anytime there's a complaint about the medical system. They are the mandate for all doctors in this province. That would probably be where you want to go to.
And when there are systemic issues, you wonder if the College of Physicians is useful at all because there are systemic issues. They allow these systemic issues to develop, right?
Yeah, I don't know.
Okay, well, thank you, and I'll go there. And if not, then I'll film a video that I'll send to the BC Minister of Health and say, I'm going to stop taking my medicine until you can help me directly get back on to it. Okay. Well, thank you. Have a good one.
Thank you. Bye-bye.
Bye-bye. So it's kind of not hard to predict what people that suffer from HsD act like, eh?